More than 28 million Americans have had COVID-19. While most have overcome the virus, for two COVID patients, recovery remains an uphill battle. They are known as long haulers. Prior to COVID, Alexandra Hackett would work out nearly 6 days a week, but now she struggles to jog more than a block and walks with a heart monitor.
Towards the end of this summer, then I started to get pains during the exercise, and in hours afterwards, I started to just get pains, which again, it was very disturbing, but you just like, no, this isn't happening. There's got to be something else. And it just got worse and worse to where the pains would last a few hours. Now they were lasting for days and they weren't going away.
Not once did Alexandra test positive for COVID-19.
By the time I went and got treatment and the doctors put two and two together that I likely had a false negative, it had been 4 months since I had gotten sick.
A new research letter published in the journal JAMA Network Open says 30% of more than 175 COVID patients still had persistent symptoms up to 9 months later. Dr. Sharifin Nahal, CEO of University Hospital in Newark, New Jersey, has studied this phenomenon.
Actually, it is the immune response that you develop to the virus that ends up sometimes attacking your own tissue, your own cells in your own body. And so that's thought to be the mechanism. Another piece of the mechanism is that your body tends to be more predisposed to clotting, which is a normal function, of course, that your body has to stop bleeding. But if it goes into overdrive, it can cause unintended consequences like risk of heart disease, risk of stroke, and some of these other persistent symptoms.
One thing Julie wants others to know is the severity of symptoms long haulers go through on a daily basis.
But, there's days where I don't know if I can handle it anymore. There's so much pain, and it's not pain that some Tylenol can get rid of.
Here's what one hospital is doing to help long haulers in their recovery process.
I actually have a convalescent clinic at University Hospital that is specialized in treating patients with long hauler syndrome. It's actually a multidisciplinary clinic that has folks who specialize in cardiology, heart disease, lung disease, of course, and other areas, neurology. We make sure that folks get the entire scope of care that they need long after they resolve from their acute illness.
Doctors don't yet know whether lingering symptoms can become permanent in some patients, but they hope that by studying those who are experiencing long-term COVID symptoms, they can prevent them in the future. Kaitia Sav for Pavement Pieces.